South Korea's population is skewing older and older. Soon, people 65 and up will account for more than a fifth of the population. That means there'll be a growing need for caregivers, and more people are now training to fill that role. Our Song Yoo-jin has this report.
64-year-old Chang Myung-cha has been taking care of a hemodialysis patient in her 80s for over a year. She starts her day by preparing breakfast before helping her patient eat, move around, and live out her day. On top of providing physical support, Chang has become a dear friend. Work is not easy, but for her, it is a labor of love.
5 years ago, I got really sick and needed surgery. Besides my family, I had a lot of help from a caregiver. Since then, I wanted to become one myself to lend a helping hand to those in need.
Chang is one of the 450,000 caregivers working in South Korea. The number of these invaluable companions is expected to rise amid a rapidly aging society. By 2025, those aged 65 and older are expected to make up more than 20% of the population, meaning more caregivers will be needed.
After an insurance law in 2008 made caregiving more affordable and available, caregiving has become a certified profession. These days, a growing number of people are preparing for a career in the industry at training institutes like this one.
This institute in Seoul was launched just 3 years ago. More and more students have been signing up each year.
Our students have increased threefold in the past 3 years. Nationwide, 280,000 people took the National Caregiver exam in 2021, which was up 90,000 from 2019.
In order to qualify for the exam, students must receive 240 hours of caregiving education. The process is rigorous, but worthwhile.
I think caregivers are needed more than ever. More seniors are getting sick, but they lack family members to look after them due to fewer kids and more working females.
However, as much as these caregivers provide indispensable support, they also need help to care for themselves.
Caregiving can be physically and emotionally draining. To prevent burnout, working hours must be adjusted while guaranteeing paid leave and counseling sessions.
As South Korean society ages, the caregiving system also needs to mature to embrace the needs of those who give and receive care. Song Yoo-jin, Arirang News.